Today, we're opening a case file, really on a hidden threat, an adversary that is quietly but dramatically changing the rules for some of the most vulnerable patients out there. We're investigating a shifting fungal enemy.
For anyone fighting cancer, the battle is already monumental. It's this daily, relentless struggle that takes incredible strength and relies on the absolute best that medicine has to offer.
But what happens when another foe, a microscopic one that often flies under the radar, starts to adapt? What if it's getting smarter and a whole lot more dangerous, right under our noses?
And that brings us to our case today. We're going to dive deep into a fungal threat that's become a huge concern for oncologists and, of course, for the patients they are fighting so hard to save.
So what exactly are we talking about? The culprit is a yeast called Candida, and it causes an infection known as candidiasis. Now, for most of us, it's pretty harmless, but for cancer patients whose immune systems are already weakened, this very common fungus can suddenly turn invasive, sparking a genuine life-or-death battle.
Our investigation is centered on this massive 7-year study out of the Jiangxi Cancer Hospital in China. Researchers there just meticulously combed through thousands and thousands of patient records to get a handle on the patterns and behavior of this fungal threat.
And almost right away, they found something strange in the data. The main suspect, the one they always expected to see, was kind of fading into the background, making way for this whole new lineup of more dangerous culprits. And that is the central anomaly of our case.
Okay, take a look at this. This graph shows you exactly what I'm talking about. See that red line? That's the historically dominant species, Candida albicans, and you can see how its prevalence is just steadily dropping over these 7 years. But now look at the purple bars. Those represent a whole group of other Candida species, and wow, they are clearly on the rise. The enemy is literally changing its face. So let's get our suspects straight. On one side, you've got the old guard, Candida albicans. This is the one doctors have known about and been fighting for decades. But on the other side, you have the new challengers. This is a diverse group called non-albicans Candida, or NAC for short. And as we're about to find out, these newcomers, well, they play by a completely different and frankly much more dangerous set of rules.
So, the big question becomes why? Why is this shift happening? To figure that out, the investigators started looking for clues. The specific risk factors that were putting patients right in the path of these new challengers.
They analyzed dozens of variables, everything from patient history to the specific treatments they received. But one clue stood out, head and shoulders above all the others, pointing a giant finger at a potential cause. So what was the smoking gun?
This number, 13.8. This was the single biggest clue in the entire investigation. So what does this number mean? It's the odds ratio, and it means that when a patient was given an initial antifungal treatment that was the wrong one for the job, their odds of getting infected by one of these new challenger species skyrocketed by nearly 14 times. Just think about that for a second. The very treatments meant to help were, in a way, accidentally paving the way for a tougher enemy to take hold.
And there were other significant clues too. The data showed that patients with indwelling catheters, UTIs, anemia, or low protein levels in their blood were also at a much higher risk for a new challenger infection. It really paints this picture of a patient who's not only immunocompromised, but is already fighting multiple battles on multiple fronts.
So, we've got our anomaly, and we've got our clues. But what's the motive here? Why is this big shift to these new fungal species so alarming? Well, the answer is a problem that honestly plagues all of modern medicine: drug resistance.
This quote from the study really nails it. The widespread use of our standard antifungal drugs creates this kind of evolutionary pressure cooker. All the weaker fungi get killed off, right? But that leaves the field wide open for the naturally tougher, more resistant species to just thrive and completely take over.
And this table shows just how bad that resistance problem is. Let's just take one of the key new challengers, a species called Candida tropicalis. Merely 75% of the samples were resistant to the drug itraconazole, 65% to posaconazole, and over 40% were resistant to fluconazole, which is a super common frontline antifungal. The so what here is absolutely chilling. It means for a huge chunk of patients, our go-to treatments might already be useless before we even start.
Okay, so we've got a shifting enemy, we know the risk factors, and we understand the motive is drug resistance. This brings us to the final, and really sobering part of our investigation, the verdict. What's the ultimate consequence of this fungal shift? And here it is, the verdict. This plot shows the risk of mortality, and after all is said and done, the bottom line is just stark. Patients who were infected with the new challengers, the NAC species, had a 1.5-fold higher risk of death compared to those with the traditional C. albicans infections.
So the big takeaway here is this. This is not just some interesting trend for microbiologists to debate. It is a tangible, deadly threat that is directly impacting whether patients survive, and it's making an already difficult fight against cancer that much harder.
And so that leaves us with the critical question moving forward. In a world of evolving microbes and growing drug resistance, the challenge is immense. How do we adapt our strategies? How do we identify these threats faster, pick the right treatments from the very start, and ultimately, how do we protect the patients who need it the most?